Too many Americans face the choice of money versus medicine. This season, we're giving you the tools to fight back, starting with simple tips right now to lower your medical bills. Let's go through a few of these. What's your first tip?
Well, Travis, bills, the best kept secret in medicine and billing. Bills are negotiable. Talk to them before you get the care, talk to them before you leave the hospital and afterwards. Try to get through to the right person. If you have trouble, do everything you can. If you feel that you've been billed unfairly, you go right to that administration. You go right to the hospital board members. We're going right to the hospital donors in some cases when the hospitals are aggressively suing patients. Hospitals are supposed to be accountable to their communities, so you can get through directly and try to work on that bill. If you deliver a baby, the price of delivering a baby, an uncomplicated vaginal labor and delivery, the entire package cost in Boston between $7,000 and $41,000. That's the negotiated insurance price. Now, is the hospital that does it at $41,000 better? Well, but guess what? They're both Harvard hospitals. In New York, it's from $4,000 to $70,000 to deliver a baby. This is the sort of demand that you can apply to hospitals to say, hey, I want to know the price because I'm trying to pick a hospital to have my baby, and see if they'll give it to you.
And you can negotiate before and after, and that's another tip, which is ask for an itemized bill. We were talking to Misty, getting all these bills, doesn't even know what they're for. And it's not always easy, but you can always ask to try to get a breakdown, right, of what I'm getting billed for.
Look, the fastest way we've seen bills get reduced, because I've interviewed for the book, The Price We Pay, the people who are receiving the money from the hospital or negotiating with you. And they say, if you tell us about financial hardship, right off the bat, they'll cut 5 to 20% off. That's all you need to do is let them know you've got some difficulty paying. You see a bill, something on your itemized bill, you can Google the code, see if you had that service done. If you didn't, they'll knock it off. They'll knock it right off. If there was a privacy violation, if you weren't given your options, if you weren't told the price ahead of time and you asked for the price, these are all rational arguments that they will sometimes respond to, and you'd be amazed at the number of times they'll have duplicate services on there, almost like a deliberate mistake.
If you're a male and you're charged for a pregnancy test, these things happen.
Or a C-section.
Or a C-section. These things happen. So another tip of yours is finding the fair market price. How do we do that?
Now there's a lot of really good websites where you can actually look up the price of a service. You can see what the going price is, what the market average payment is that a hospital accepts, and those websites are sites like fairhealth.org, Florida Price Finder. There's several of these sites out there. I like Healthcare Blue Book. It makes sense, like Kelly Blue Book. There are market reference prices for things, and those are powerful negotiating tools when you go to a hospital and say, look, will you accept the money that you accept from any other payer or from the government for my services?
And as we run out of time here, you say paying with cash can be beneficial, but talk to us about when you contact financial aid or a financial aid program at a hospital, what's the best approach?
Well, what people don't realize is that if you simply ask for a financial aid program, oftentimes they're prepackaged. And if you make, for example, below 200% of the federal poverty line, that is if you're less than double the poverty number in your income bracket, oftentimes they'll either forgive the bill entirely as a part of a federal requirement, or they'll work with you if you're just above that. Most hospitals do the right thing. Most people we know who run hospitals are good people working in a bad system. And if we can make that appeal to them, we can appeal to the best in people.
I'm glad you said that, because the fire, especially when we started this conversation, the fire is because the system has been set up to fail so many people. But that doesn't mean that the people in the system are bad people. And your head may be spinning right now. I know mine is, but there's good news. Dr. Makary wrote a book. His book is called The Price We Pay. It's on sale now. I highly recommend you pick up a copy. You will learn more about lowering your medical bills than probably anywhere else.